Hi there, my name is Samantha, and I'm a nurse in the Mother-Baby unit at the Ottawa Hospital. In this video, I'm going to share some basic information with you about how to take care of yourself following a cesarean birth. Overall, it'll take about 5 to 6 weeks for your cesarean incision to fully heal. In this video, I'll go over some of the things you can expect in this time. We're going to talk about dressing and bandages, bathing, physical activity, how to care for your incision, and what signs to look for in case of an infection. Before we begin, please note that the information in this video is not medical advice. Some of it may not apply to you. If you have any questions, please talk to your doctor, nurse, or other healthcare team member. For urgent matters, please call 911 or visit your nearest emergency department. All people who gave birth by cesarean section have a dressing covering the cesarean surgical cut. We call it an incision. Most of the time, nurses will take off this dressing before you're discharged from the hospital. No matter what dressing you have, tell your nurse if your dressing has some blood or fluid on it. It needs to be changed to prevent infection. If you have a Pico 7 dressing with the pump, it will stay on for 7 days after your cesarean birth. You'll need to take this dressing off on day 7 after giving birth. You can throw out all the dressing and all of its parts. Here is a helpful tip. Removing the dressing in a warm shower makes it easier to peel the dressing off as it is less sticky when wet. If you need more information about the Pico 7 dressing, please check out the negative pressure wound therapy sheet that was given to you when you arrived on the Mother-Baby unit. If you have steri strips covering your cesarean section incision, they will fall off on their own in about 7 days from your cesarean birth. If your steri strips start falling off before day 7, this is okay. Most of the time, cesarean incisions have stitches that are self-dissolving, so they don't have to be taken out. They will self-dissolve by 8 weeks after your cesarean birth. If you have staples, please follow the discharge information about when staples need to be removed. Usually, you will be sent home with a staple remover that you can bring to your family doctor to remove your staples. A healthcare provider needs to remove the staples 7 to 10 days after your cesarean birth. If you're not sure if you have stitches or staples, ask your nurse or doctor before leaving the hospital. In the days following your cesarean section, some bruising, redness, and swelling around the incision is normal. As the incision heals, the swelling and bruising will get better, and the redness will slowly fade. You may also have some numbness or itching in the incision area, even after it has healed. Overall, it will take about 5 to 6 weeks for your cesarean incision to fully heal. However, you may not feel back to your full strength until about 10 to 12 weeks after your cesarean birth. This is normal. Once your dressing is taken off, you need to take special care of your cesarean incision. Do not have baths or sits in water. You should only take showers for the first 6 weeks after giving birth. Taking showers only reduces the risk of you getting an infection. Use mild soap when showering, and do not scrub your cesarean incision. Just gently lather the soap over it. Ensure you rinse the soap well with water. Gently pat dry your cesarean incision with a clean towel after a shower. Always make sure the incision is completely dry before you putting on clothes after a shower. Do not use any extra lotion, products, or items like stomach binders on your cesarean incision without first talking to your healthcare provider about it. Lastly, you need to watch for signs and symptoms of infection in your cesarean incision. This is also called a surgical site infection. The signs and symptoms may include new pain, worsening pain, or pain that does not improve, swelling, warmth, increased redness, an increased amount or change in color or smell of fluid coming out of the incision, pus, such as yellow or green liquid, draining from the incision, your incision opens up, or you have new bleeding from your incision, a fever of 38 degrees Celsius or higher, chills, and/or you're generally feeling unwell. If you have any of these signs or symptoms, please tell your healthcare provider as soon as possible or go to your local emergency department. That concludes our after-birth discharge information video. Please let your nurse know if you have any questions or concerns regarding the information in this video before you leave the hospital. Or, if you have already been discharged, reach out to your healthcare provider with your questions. For more information about caring for your baby and yourself once you've been discharged from the hospital, the links to more helpful videos are in the video description below.